various committees, societies and associations that were continuously being set up to review, regulate and control all aspects of scientific medical research and education. It did this by making donations to many of these organizations, such as the British Association for the Advancement of Science, the Parliamentary Science and Technology Foundation, the Parliamentary Office of Science and Technology, and the British Medical Association's Foundation for AIDS, to which it gave £144,000 between 1988 and 1992, and by placing its own trustees, researchers and experts in prominent positions within them. For example, Sir Alistair Pilkington, one-time Vice President of the Foundation for Science and Technology, was a research scientist for Wellcome. Professor C. Gordon Smith, Dean of the London School of Hygiene and Tropical Medicine, was a Wellcome trustee. Lord Swan, Director of the BBC and the 1980s, was a Wellcome trustee. Sir Alfred Shepherd, a member of the Advisory Council on Science and Technology (ACST), was chairman of Burroughs Wellcome and the Wellcome Foundation until 1985. Professor Roy Anderson, head of Pure and Applied Biology at London Imperial College of Science, Technology and Medicine and a member of ACST, was also a Wellcome trustee. In the 1980s, however, the company went through some major rationalizations. In 1986 the decision was made to sell shares in the Wellcome Drug Company, which had previously been owned in its entirety by the Wellcome Trust. In the following 6 years it also sold off several areas of business, including Cooper Animal Healthcare, a joint venture with ICI producing organophosphate sheep dip, and its interests in vaccine production. Production of general cough and cold remedies was also reduced to a mere 14% of sales, while it began concentrating its funds into more profitable areas of genetics, biotechnology and antivirals. AZT, marketed by Wellcome as Retrovir, had been developed in the 60s as a drug to treat cancer, but it had proved to be highly toxic as well as ineffective, as it appeared unable to distinguish between cancers and healthy cells. However, tests in vitro appeared to show some antiviral properties, which was why, after being shelved in the 60s, AZT was retested for use in the treatment of AIDS in the 1980s. Human clinical drug trials, following extensive, though useless, animal testing, usually take place in two parts. Phase I tests for toxicity, Phase II concentrates on the long-term side effects and efficacy, all of which can take several years. In the case of AZT, the Phase II trials in America were halted after 4 months when only one of the AZT users, as opposed to 19 of the control group, had died, and the drug was granted a license despite the fact that the patients in the trial were given regular blood transfusions to alleviate the possible side effects. This should, under usual circumstances, have negated the results of the trial. This licensing of AZT so quickly was unprecedented and made Wellcome's profits double to £1,132 million in the space of 4 years. As if this wasn't enough, subsequent licenses for other AIDS drugs were issued subject to the condition that they would have to be tested against AZT and then only prescribed in conjunction with it. Incredibly, AZT was licensed in the UK without any clinical trials 4 weeks before it was licensed in the US. This, perhaps, may have been due to the fact that, of the 25 members of the Medicines Commission who are parliamentary advisors on medicine, 5 had interests in Wellcome, one prominent member being Professor Trevor M. Jones, Director of Research and Development at Wellcome. And of the 21 members of the Committee on the Safety of Medicines who grant the licenses, 2 had interests in the Wellcome Foundation. Within a short space of time, AZT was licensed in 35 countries around the world, and Wellcome were promoting it with media advertising, press releases and all expenses paid conferences to which they regularly invited the world's top scientists and physicians, all the while denying any suggestions that it caused harmful side effects. Wellcome's influence on the media and the government continued with its donation of £10,000 to the All-Party Parliamentary Group on AIDS, APAGA, as, with the Medical Research Council, Wellcome began the trials of AZT on asymptomatic HIV-positive patients, the Concord trials, in October 1988. From that point onwards, most of the doctors presenting information and writing for APGOHA were also involved in these trials. Not content with promoting their own research in the area of AIDS, they also began to attack any alternative treatments or anyone who challenged the HIV=AIDS hypothesis. Wellcome had also cornered the British market in AIDS testing kits. With the help of Dr. Robin Weiss and Angus Dalglish from the Institute of Cancer Research, a second-generation kit was marketed based on the Research by Campaign Against Health Fraud. Now HealthWatch member, Professor Vincent Marks, head of the biochemistry department of Surrey University, a department which has received over £500,000 from Wellcome since 1985. In order to ensure that anyone found to be HIV positive was immediately directed towards help from AZT-promoting doctors, GPs were given very limited access to the testing kits. They had no choice but to send their patients to Wellcome-infiltrated teaching hospitals and STD clinics in London, while the promotion and sale of home testing kits was banned in the UK, in 1992. Thereby ensuring Wellcome's complete monopoly in all aspects of AIDS treatment and diagnosis. Education about HIV and AIDS could also not be overlooked, and Wellcome donated substantial funds to pay for a £150,000 package for GPs, produced by the British Medical Association. The Concord trials themselves, instead of being independent, were almost totally under Wellcome's influence. The initial reason for the trials was to prove that AZT would be effective in preventing the development of ARC and AIDS in otherwise healthy HIV+ patients. Going against all established regulations for the independence of such trials, which in the past had the drug companies supplying the drug and paying the hospitals to do the trials, the Concord trial was set up jointly between Wellcome, the Medical Research Council, MRC, and the Department of Health. The MRC paid for the treatment and the Department of Health granted the use of 6 London hospitals, NHS staff and facilities. Anyone with an HIV-positive test was encouraged to join the trial without discussion of any alternative treatments, whilst being promised up to 3 years of free healthcare, despite the fact that the AZT drug was to be administered at 1,000 milligrams per day, twice the dose recommended by the U.S. Food and Drug Administration, and the recent reports of serious side effects such as muscle wasting, anemia and impotence. Wellcome's crowning glory in this deal, though, was to also insist that the contract gave them complete control over the writing of any reports about the trial. The only report which had to be agreed between all parties was the one for general publication, if indeed any published report was even deemed necessary. Just to make absolutely sure of obtaining the desired outcome, Wellcome had the help of several friends in the MRC who had just as many, if not more, commitments to industry and business matters than they did to the medical establishment or the government. Lord Jellicoe, chairman of the MRC's AIDS Committee, was a director of the Rockefeller Company Morgan Crucible as well as the sugar company Tate and Lyle, and was later chairman of Booker Tate Confectionery. Sir Donald Acheson worked for the Department of Health but left in 1991 to work in the Rockefeller-funded School of Hygiene and Tropical Medicine. Sir Austin Bide was chief executive of Glaxo, now in partnership with Wellcome, and had been a director of J. Lyons & Co. Confectionery in the 70s. Sir David Crouch, MP for Canterbury until 1987, was director of Pfizer Limited, a pharmaceutical company which was the only manufacturer of a synthesized ingredient of AZT at that time, and also ran several public relations companies, one of which, Kingsway Rowland, handled Wellcome's AZT account. Dr. J. W. G. Smith, director of the Public Health Laboratory Service since 1985, used to be a senior lecturer at the School of Hygiene and Tropical Medicine before going to work for Wellcome as head of bacteriology in 1969. Professor D. A. Worrell was a director of the Wellcome Tropical Research Unit and has also done malaria research funded by Welcome and the Rockefeller Foundation. Professor C.N. Hales is a specialist in diabetes whose research is often funded by pharmaceutical companies including Wellcome. With the above as the only 8 members of the MRC Committee on AIDS and their chairman Lord Jellicoe, it is not surprising that a drug once deemed to be too toxic, which has never been properly tested and whose side effects, according to the British National Formulary, bear a striking resemblance to the symptoms of AIDS itself, has been allowed to become the AIDS drug of the 90s and has capped the profits rolling in for Wellcome to the tune of an estimated £400 million a year. I will give no deadly medicine to anyone if asked. From the Hippocratic Oath. Walter's position as a staff nurse at Newcastle General Hospital's Infectious Disease Unit, Ward 25, which is affiliated with the London School of Tropical Medicine, has given me an insight into the world of AIDS treatment which is rarely seen, and it only serves to corroborate the research of the aforementioned enlightened scientists, whose numbers are ever increasing. The world of AIDS care and treatment at the NGH has some very sinister elements, and I have no reason to suspect that it is isolated to this regional unit alone. Here is an outline of some of the information which Walter has provided. According to the Code of Conduct provided by the United Kingdom Central Council for Nursing and Midwifery, the nurse's role is to be the patient's advocate and is, therefore, entrusted to provide care in the best interest of the patient and to decline from doing anything which is detrimental to their well-being. One of the major areas covered by this is in the administration of drugs. The nurse is responsible for ensuring the correct dosage of drug is given and is responsible also for being aware of the effects and possible side effects of the medication. However, in the NGH unit, nurses are expected to give all drugs prescribed by the doctor whether or not any information on the effects of the drug are available. Frequently the prescribing doctor is unaware of the true nature of the drugs and thus unable to inform the nursing staff of the effects and side effects of the drugs they are using. Many and varied substances appear and disappear periodically from the drugs cupboard, often named only as a series of numbers or letters. When challenged as to the reason why they have prescribed such unknown entities, the doctors usually reply that their consultant has ordered it to be given. The consultant is usually unavailable for comment. The side effects of the drugs have been seen to be potentially harmful. For example, one commonly used drug, foscarnet, which is given directly into the heart or eyes of a patient, when dropped on a nurse's tights dissolved them on contact. Common side effects of this drug include epilepsy, blindness and dementia. Many patients have entered the unit with minor symptoms such as weight loss and have, in a short space of time, become blind and epileptic through using it. Walter has frequently said to me, "I'm poisoning people for a living," but if he refused to give the drugs as prescribed he would lose his job and someone would be found who would administer them. The same is true of the junior doctors who are afraid of the vengeance from above if they were to challenge the status quo. No challenge has yet been made, even after I presented the unit with detailed papers outlining the research which has negated the HIV=AIDS myth. Once diagnosed as HIV positive, many patients are then informed that the only chance they have for extended survival is to use the drugs provided. Obviously the majority of patients, many of whom show very few symptoms, are too afraid not to cooperate with the regime. They then suffer terribly and die a lingering and undignified death. As a response to many challenges Walter has made to the medical staff to justify their drugs regime, he has been branded cynical and defeatist, as not wishing to give the patients a chance for survival. In reply to this he has asked on many occasions for the doctors to give him even just one example of anyone whom they have cured of AIDS or significantly improved the quality of life. Not one of them has been able to give such an example. even if we were extending people's lives.